We have a lot of things to get done, so we're going to get started. I'm Andy Schwartzman. I'm the Benton Senior Counselor at the Institute for Public Representation at Georgetown, and Benton Foundation and Institute for Public Representation are happy to be able to co-sponsor this event along with Commissioner Clyburn. I am not going to spend a lot of time here. I simply want to make a few tiny helpful observations. Number one, please turn your cell phones off, or at the very least, set them to stun. Number two, there's a Wi-Fi password in the back. Number three, restrooms are on the other side of the building, alongside the elevators. I want to thank David Grossman, Commissioner Clyburn's legal assistant, for making this happen, along with our assistant at IPR, Nico Peretich, who facilitated this, along with the people at Georgetown. Okay, I'm now going to introduce Commissioner Clyburn, who will officially kick things off and welcome everyone. She is a hero of many of us. Her service on the FCC and as acting chairman has been magnificent. She has a stellar record of supporting the needs of all Americans, and the effort and time that she put into developing the policy discussions that took place around the country and are culminating with this discussion is something for which we can all be very grateful. Now I'm going to turn it over to Commissioner Clyburn.
Thank you very much, Andy. I really appreciate that. I need to take you home with me. I'm headed home this weekend. I had a conversation with my mom, and her introduction or her exchange with me was not as flattering, so maybe I need to take you with me. Be hard to explain, but we'll work that out later. This event would not be possible without you, Andy, without all of you in the audience and the generous support of the Georgetown University Law Center, specifically the Institute for Public Representation, the Benton Foundation, and for that I am forever grateful to all of you. And for those of you in the room, many of you who have traveled distances, long distances to be here. And for those of you watching online, get ready for a policy program forum that you have not seen before. It will look very different from what you've become accustomed to in Washington, D.C., and that is a good thing, particularly the season. Change and interesting dynamics. I just won't say any more before we all get in trouble. But Solutions 2020 was built on this belief that most of the challenges facing the communications sector are already known to each of us. Millions without high-speed broadband, the lack of viewpoint diversity in high-tech or on our public airwaves. We all know about these challenges. What we need is less talk and more action. What we need are solutions that can be implemented over the coming months and years, not the next quarter or next century. So for the next 4.5 hours, let us go on this journey. Let us dive in with 4 lightning rounds on bridging the affordability gap, combating inequality in the communications sector, digital inclusion in the 21st century, and unlocking the 5G revolution. During each of these sessions, invited participants will give a 3-minute, yes, that's a 3-minute solutions-focused pitch. Once all of the participants have delivered their pitch, the moderator will turn to the audience, and that is you, and outline any questions that you will have or that they will have. And your participation here is critical to ensuring that this is an interactive conversation. This will not be fulfilling to all of us if it's not interactive. But we do have to lay some ground rules for this dynamic framework. For those in the room, you will find an index card on your seat, and you have 2 options. You can write your name, affiliation, and question on that note card and hand it to any member of our staff, or you will find roving microphones with our two end turns, where you'll be able to ask your question directly. But there's a catch. You only have 30 seconds to do so. And yes, it is true. We will hold you to 30 seconds to do so. And when the stop sign goes up, that mic will suddenly disappear. So please, if you want to, you've got the option, but know the rules. And for those of you who are watching online, if you have a question, you can, of course, post it on Twitter using the hashtag Solutions2020. Make sure to indicate who the question is directed to. Now, once all of the participants have made the presentations and have answered your questions, the presenters will have an opportunity to make a 1-minute, yes, a 1-minute closing remark. This non-traditional format is intended to spark actionable next steps for some of the toughest issues facing the communications sector, but we will do so in a way that affirms just how motivated we are to act and to act quickly. Our 150 session on exploring the intersection of broadband and health is the exception to this format, however. It will be conducted in a traditional panel format. Audience participation is welcome after all of the panelists have made their remarks. So once again, I want to thank everybody for being here. And now I will turn the mic over to Dr. Nicole Turner-Lee from MMTC. She's a good friend, so she'll forgive me for messing her name up a little bit. Dr. Nicole Turner-Lee from MMTC, who will moderate our first session on bridging the affordability gap. Thank you and welcome.
All righty, let me do a couple of things here. First, as you can tell, I'm not Commissioner Clyburn, so I'm going to change this so that our audience doesn't think I'm Commissioner Clyburn, although I want to be like her when I grow up. Let's give her a hand for actually hosting this event. And I want to reiterate, my name is Dr. Nicole Turner-Lee. I am VP and Chief Research and Policy Officer at the Multicultural Media, Telecom, and Internet Council. Very happy to be here today and very intimidated because I'm the first panel. So if I blow this, it's just going to mess up the whole program. So we're actually going to do this in a way that keeps the energy and excitement around what this panel and this whole workshop is entitled, which is Solutions 2020. And how many of you here have been in conversations around digital divide and you think you've heard sort of the same thing that you heard before? Well, we're making the vow today to not do that by being much more solutions oriented, because not just because we want to fancy ourselves, but the constituents that Commissioner Clyburn referenced are the people that we should care about the most. And they deserve this opportunity for us to walk out of here today with some solutions that are actually going to address those verticals. So I have the pleasure today to host this conversation with four very qualified, uniquely qualified folks that are going to address the first vertical, which is broadband affordability. And broadband affordability, for those of us that are in the research community and the policy community, this is not something that is new to us. We have tackled with this issue of ensuring that broadband is affordable for all citizens of this country. And though just recently the NTIA came out with a study saying that relevance is still a significant factor, the bottom line is that if you do not have the resources to be able to afford consistent service, you are locked out of what we consider at MMTC to be first-class digital citizenship. So we've got to figure out a way to actually solve that. Last July, the Pew Research Center essentially published this report that said that 15% of Americans are still offline. And as a sociologist, I consider those 15% to be what Michael Harrington called back in the 80s, and no, I still looked funny, which is the other America. They are the disabled, they are seniors, they are low-income populations, and they are disproportionately represented by people of color. So we've got a challenge for you all today, and that challenge is to figure out what is actually working. We know some things on the ground have worked in terms of public-private partnerships. We know that there have been other efforts, and Chike is here in terms of comprehensive services that are coordinated in a way to make the access more affordable. but you all have a challenge. So I'm actually going to introduce our panelists first, and I'm going to have them come up, as Commissioner said, to actually pitch their solution. I get the great, I don't want to say I'm Oprah, but I get that great way to actually ask the first question. And then, as the Commissioner said, everybody has 30 seconds to actually ask your question to the panelists at the end. So there are index cards on your seats to actually parking lot those questions so you don't lose that train of thought. So let me introduce our panelists and have them come up in the order that I call their names in terms of introduction. The first person we have here is Chike Agu, who is the CEO of Everyone On. Raise your hand. Diane Smith, who is the founder and CEO of American Rural. We've got Brian Mercer, who is the executive director of the Media Mobilizing Project. And last but certainly not least is Ann Schwager, who is broadband and digital equity advocate for the City of Boston, the Department of Innovation and Technology. Let's give them all a round of applause. All right, Chike, not to put you on the spot, but you're up first. And why don't you come to the podium, and that way everybody can see.
First of all, thank you to Commissioner Clyburn and Benton Foundation and Dr. Turner Lee for having us. Could we just give them a round of applause before we start? So you're going to hear a lot of talk from my very esteemed colleagues about how we make the internet more affordable so that people who actually need the internet have the resources to pay for it. I'm going to talk about a slightly adjacent challenge, which is actually as or almost more important. And particularly in the light of all the reforms that we've seen in the last 4 or 5 years, from Lifeline reform to new low-cost offers, what we've found in our work at Everyone On in connecting over 350,000 people in 48 states across this country is that affordability without accessibility is meaningless. Let me say that again. Affordability without accessibility is meaningless. If folks cannot get access to the resources that you are making available to them, whether they be a subsidy, whether they be a low-cost offer, it might as well not exist. And this insight is further informed by my prior career in technology, designing products. And what always strikes me is how differently we think about consumers than people on the wrong side of the digital divide. If you think about technology companies, they make it as easy as possible for you to access their product. For your iPhone, if you don't want to put in your 4-digit code, you can use your fingerprint. If you have too many passwords, there's an app to help you remember them all. Think about how we work with people who are on the wrong side of the digital divide to access low-cost offers. You need tons of documentation. You need to go in person somewhere to some office to prove that you deserve that benefit. And then on the back end, you need to come back year after year after year to prove that you're still eligible. None of us would do that to use a product. But yet, for this thing that is as vital as the internet, we make people who are on the wrong side of a lot of other divides do that same thing. So the question is, how do we create a one-stop shop, an amazing customer experience for people who are on the wrong side of a digital divide to access those products? And for us, the best example that we can think of is motor voter legislation. For those of you who don't know what that is in states where when you get your driver's license, they ask you if you want to vote. For all the people who are accessing things like SNAP, like free and reduced school lunch, public housing benefits, when they access those benefits, we should ask them a very simple question. Do you have internet service and do you want it? If you do, here's a very simple digital resource like everyoneon.org as an example so that you can access that service. So that instead of going back to them again and again and again when folks are working 2 jobs, have kids that they need to get from school to home and back, we are hitting them one time in one fell swoop, getting them exactly what they need. The same way that each of us expect to access the vital services in our own lives. So we want to talk about how do we make this a one-stop shop and have accessibility tied to affordability.
All righty, let's give them a round of applause. I'm trying to think, do I stand up? Okay. All right, so I get to, and again, if you have a question, please put on the index cards. In a few minutes, I'm going to have you come to 2 of the mics that we have positioned. So I was taking notes, Chike. I want to talk to you about this. I think what I heard you say is that it's important, your solution is a one-stop shop that sort of imposes market-based behaviors, right, on how people get access to low-cost offers, particularly when you're dealing with affordability. So my question to you is, how do you do that with a more traditional service delivery model that is not necessarily market-driven? So right now, people have to show their income through all these forms to actually qualify for these programs that you're talking about. But I like what you're saying. I should just be able to go and get my internet access just much like I buy something else, right? My groceries or something else. So help me understand how you actually harmonize those.
Let's use a really clear example. The Public Housing Authority of Miami-Dade County in Florida. Every year, if you live in public housing, you have to actually go back into your property management office to certify that you are still eligible for those benefits. So we asked a very simple question. When they come in to the office every single year, which you know they're going to do, can we also ask them, do they have internet service? And if they don't, can we put them through our digital resource so that they don't have to come back again to access that service? So we have these touch points in these systems that one could argue are a little analog, but we know they're going to be there. So let's use that opportunity to get them access to this service that we know that they need, that they know that they want, and let's make it as easy as possible.
Okay, so I actually broke the rule. I'm going to go to the next panelist, because if not, we won't actually get there, because I got a couple more questions for you. Let's now go, first of all, let's give Chike a round of applause. He got my mind thinking. Maybe I need an index card, because I have all these questions. Let's now go to Diane, who's from American Rural.
Thank you. Thank you. It's great to be here. I am here today from Columbia Falls, Montana, where it's snowing. And I have a little bit of experience in pitches because I'm a technology entrepreneur from Northwest Montana. So I've done my share of elevator pitches. And the first several that I did were actually really bad. So I'm hoping to do better than that today. But I wanted to say a few things about rural America. First of all, it's really big. And I think one of the things that we tend to lose sight of is that there are 59 million people living in an unincorporated community of under 2,500. There are another 28.8 million people living in a community like mine that's incorporated but has between 2,500 and 50,000 people. That's almost 90 million Americans living fairly off the beaten path. And for us, we have density issues. So I loved what you said, Chike. I thought that was awesome because for us, a lot of our folks are driving really long distances. So one of the things I would also say is we are frequently absolutely as dependent on mobile technologies as a lot of our urban neighbors because we are driving around a lot of the time. So from a policy perspective, I want to say a couple of things. The first thing, and let me go to my notes here because I want to make sure I get it, we have to evaluate strategic government partnerships and make sure that we're deploying funding properly. That can include both CapEx and OpEx. We need to allow for hybrid networks if that's the best thing for the geography or the terrain. We need to understand that many traditional models of competition for dense populations don't work in our backyards. And we need to ensure that all of these rural Americans, many of whom I meet every day, who are entrepreneurs and innovators, because many of them were raised by entrepreneurs and innovators. They are absolutely reliant on these technologies, and they need to be part of the 21st century going forward. When government and carriers can collaborate together to come up with optimal solutions, then everybody wins. And we want to make sure that in rural America, the understanding that broadband is a journey, not a destination, really takes hold so that all of us who are living off the beaten path can participate in a future that's rich with opportunity. Thank you so much for doing this.
Wow. Okay, I'm holding my question, Diane.
Okay.
Let's go now to the third person, Brian Mercer, who is part of the Media Mobilizing Project, the executive director. Come on up, Brian.
Thank you. Thank you all. It's really a pleasure to be here today. So Philadelphia, where I live, has one of the lowest high-speed broadband penetration rates in the country, and that's because we're also the poorest big city in the country with thousands of seniors, families, and workers who just can't afford to get online. I grew up in Logan in North Philadelphia, and where my sister and mother, they still live in that neighborhood, and the median household income there is $30,000 a year. In the neighborhood where I live in West Philadelphia, in Concessing, the neighborhood household median income is only a few $100s more. Many of the families, neighbors that I know that are around my family, they can't afford to connect and get online. And last year, an independent needs assessment found that Philadelphia consumers pay on average hundreds of dollars more to get online than consumers in similarly sized markets. And just last week, many of us probably saw the Center for Public Integrity published a story with Ars Technica finding that large non-cable internet companies are often offering faster speeds in richer communities. In my experience, core to changing this situation is engaging directly impacted communities in organizing for affordable and equitable access. In Philadelphia, we organized thousands of low-income Philadelphians with the Cap Comcast campaign to push Comcast as a condition of the cable franchise renegotiation there to expand Internet Essentials and other discount programs to hundreds of thousands of people in the poorest big city in America. Because we and our elected officials centered the idea of Internet access as a human right, key to good health care, education, and jobs, we were able to win demands that pushed our city and the cable franchise basically to make the right to internet a real referendum on the city's agenda. In response, cities like Seattle, Baltimore have looked to this model. Cable franchises shouldn't be the vehicle to do this, but it is a way that communities can get directly involved on the local level. Students, teachers, parents, and elders, techies, entrepreneurs, mom and pop shops should really band together every time their local providers are up to renew access and push for expanded, affordable internet for everyone in their community. They should use this rare opportunity to educate local officials, neighbors, on what it looks like when we give access to our rights of way, to make sure that there's real competition, and we should work to get the laws off the books that prevent municipal broadband in places like Pennsylvania. As the issues like the Telecom Communications Act rewrite comes up, we think that pushing ways for communities to get directly involved in organizing are a critical step to making sure that they have affordable access that they need. Thank you.
All right, last but certainly not least, and I'm going to step down this way so that I don't run across the stage, is Ann Schwager, who's broadband and digital equity advocate from the city of Boston. Come on up, Ann.
Great. Thank you so much, Dr. Turner-Lee. Good afternoon, everyone. Thank you, Commissioner Clyburn and David, for making this possible, and to the Benton Foundation for playing a huge role in this event and in this space in general. My name is Ann Schwiger. I have the honor of serving the city of Boston and its mayor, Martin Walsh, as broadband and digital equity advocate. As is the case for many American cities, Boston's broadband ecosystem does not fully serve the needs of our constituents. The near monopoly situation that has come about has resulted in 90% of residents having a single option for home broadband service. We, at the same time, are experiencing very low levels of home broadband adoption among low-income Bostonians. Over 1 in 5 households do not subscribe to high-speed internet in the home. So thank you so much for this opportunity to pitch you on what we are pursuing in Boston to address these interconnected challenges. So we need to have a near-term and a long-term strategy. In the near term, we will continue to make access to low-cost offerings easier. I really appreciate the points that Chike shared about that, and I'm going to take a lot of that home, and I hope we can reconnect on that later. We will continue to expand access to affordable and up-to-date digital tools, and we will ensure that opportunities to gain digital skills are available all across Boston's neighborhoods so that everyone might leverage broadband to meet their own and their families' and their communities' goals. The city believes that it must also have a big long-term vision, and as part of this, we have strategies in place that we believe that over time, not overnight, but over time, will get us to a point where our broadband ecosystem actually is one that enables each resident, each business, and each institution to have a choice of 2 or more wireline or fixed wireless options that are true broadband and that are truly affordable. Here are some steps that we are taking in our long-term vision. First, we are exploring how the city might continue to preserve its historical appeal and celebrate the boldness, diversity, and personality of our neighborhoods, while simultaneously streamlining policies and permitting related to private investment in broadband infrastructure. In order to reduce the cost of market entry, we are also working to make available on a non-discriminatory basis and on attractive terms city assets, such as fiber, lights, rooftops, street furniture, traffic signals, and other assets. And as a final example, we are connecting our broadband goals to our strategies around population growth. Boston is adding 53,000 new units of housing by 2030. If properly harnessed, this building boom creates an opportunity for our building stock to enable consumer choice and to be responsive to emerging technologies. Thank you very much.
All righty. So I have a few minutes to sort of ask a couple of questions. And like I said, just for process, the microphones are at both sides of the room. If you have a question that you've had on your index card, please feel free to come up and ask a question. So I wanted to summarize just in my brief time and then have it kick off that I think we heard about 4 or 5 solutions, right? So just make sure you all were listening. Let me make sure I've heard them correctly. I think the first solution has been around the seamless accessibility, right? The making the user experience much more seamless so that people can feel better integrated as you offer these affordable low-cost programs. The second one is around strategic partnership and collaboration, right? And particularly in the rural area where you want to bolster different types of technologies to get access to people. Brian, you talked about community engagement and awareness and how the community actually plays a role in ensuring that they actually get the type of access that they need. And I think what we heard from Ann is this comprehensive digital inclusion strategy, right, that comes from cities that's more niche-based and customized to the populations that you're trying to serve and reach. Did I get that right? I think that's what I heard in all the pitches. So with that, I'll throw out one question unless we have anybody lined up now. You all who know me know that I'm not a shy person. I'm not going to call anybody. But if you do have questions, please ask them. I want to start with, since I already cheated and asked Chike's question, I want to go over to you, Diane, with regards to your suggestion. What can be done to actually foster these collaborative private sector, public sector partnerships, particularly in the area of rural, where we've seen a lot of investment go to rural? You know, how do we amplify or get to the next phase of these types of collaborative projects so that we actually see outputs?
Yeah, it's a great question. Part of it is getting the right people in the room. You know, it's the, you know, who's on the bus story. And so the carriers have to be part of that. The infrastructure providers have to be part of that. The high-level users, whether or not, you know, again, their schools, libraries, whatever, all of those folks. But also I think the communities have to be involved and the individual users. When I started a technology company, people said to me, how'd you start a tech company in Northwest Montana? I said, in a coffee shop with Wi-Fi, kind of like you do anywhere else. And I was going to have, as a user and a big user of tech, a very different perspective than a lot of the other people that are typically invited into the room. And so I think part of that is to engage in, I suspect, a lot of the same outreach that you're talking about. It's harder to find those folks sometimes in rural America. There are a lot of people, you know, that are inventing things way off the beaten path, and they're hard to find. But if you plug into your chambers of commerce and your local economic development folks and stuff like that, they tend to know who they are. And so I would get a bigger table.
Mm-hmm. Mm-hmm. That's a good way to think about it, right? A bigger table. Okay, now we have a question, and we also are taking questions from Twitter and other the hashtags. So please have them come virtually. I'm going to ask this question, and then I'll come back to my questions. Sure. This is from an audience member who asks, the case for why the affordability gap warrants our best attention and efforts to close has been well established, so we know we have to do this. What is the best first step we can collectively take to begin to close the affordability gap? And again, in the context of your pitch, try to place it there, but if anybody can answer this question. What is the collective collectively the first step we can all take?
I think one of the important first steps is really thinking about how it's locally and specifically relevant for people, really thinking about what are the assets in a community, what are the challenges that are being faced in that community, and how to connect the challenge of access and affordability to those challenges. Internet is really a connective tissue for so many parts of people's lives, and if we think about it as this kind of abstract good, then we miss the point and relevance that it has for people, but we also miss the real challenges that people face. So we have to talk about employment and jobs. We have to talk about health. We have to talk about education and really connect the challenges of access to those pivotal and critical needs in people's lives.
Mm-hmm. Make it relevant. Did you want to jump in, Ann?
Oh, sure. I think that we should continue to do a lot of what we're already doing. Everyone on has been incredibly effective in enrolling more people in low-cost offerings. The triple threat, if you will, approach of focusing on skills, tools, and connectivity works. But we also can't lose sight of the fact that we are in an affordability, in the situation we are in many markets because there is a lack of competition. And particularly as we move forward with implementing the Lifeline program, I think it's going to be incredibly important, perhaps more so than before even, that we bolster competition so that we don't have, just like another divide of low tier, regular tier, and high tier offerings.
Mm-hmm. Chike, and I have another question for you, Chike, too.
Sure. I would say, and I'm going to be very specific here, we have a reform that was just passed in March with Commissioner Clyburn's leadership being a reform of the Lifeline program, basically being a $9.25 subsidy for internet service for people. Listening to the FCC, I believe last month, that potentially reaches 20, 30, 40 million people. If you were to go into communities that we work in, Choctaw Nation, Southeast DC, Bed-Stuy, Brooklyn, and ask them, how many of you are aware of this program? The answer would be in the single digits. We have to get this out to as many people as possible, one, for the quality of life impact for those particular people so that they have this internet service so it can change their own lives, but also we're creating a political constituency that is now invested in this. If you want to look at an example, look at the Affordable Care Act. However you feel about it, there are now 8 to 16 million people who are invested in this act being successful. There's a similar need for that type of organizing in a very brass tacks way to get to that affordability. So I would say get Lifeline out to as many people as possible, as quickly as possible.
And for those of you who are watching, again, go to fcc.gov to get more information on the Lifeline modernization reform that just happened this year. As my 80-year-old aunt keeps asking me, who's a Lifeline recipient, when does it start for me to get my broadband? And so, again, we've got to get that message out because consumer education is going to be critical. I want to go to just Mike from the Alliance for Community Media did have a question on the seamless integration of these low-cost programs. Could digital badges be viewed to simplify the qualification systems for affordable access? And, of course, I'll direct it to GK, but anybody can answer.
So if I understand the question correctly, and if we're thinking about that triple threat, as Ann talked about, digital literacy, connectivity, and hardware, can digital badges be part of the way that we make that seamless? I think so, but again, I always start with the first order question. How does the badge get to the person? If I'm a mom who works and goes to community college, how do I get access to that training, to that program in a quick, easy, seamless way? That doesn't take me out of my routines. I don't have time for that. So that's always the first order question. So I think the answer is yes, but it's always about how do I actually get it in people's hands. If you ever ask a technology entrepreneur, and I'm sure you've been in these meetings, they ask you, how do you get in front of the customer? And you have to have a really good answer, and I think we really need a good answer in this space.
That's right. Well, this is why this is a pitch competition, right? Mm-hmm. If we want to recreate the old service delivery models, we'd have to call something else. And we have to be a lot more proactive, particularly since we want people with digital technology to be more empowered than enabled. And I think that's such a great point, a great question. Brian, I had a question come from the audience or Twitter. Why can't cable franchises be the vehicle for communities to express their needs? And what can be done to expand this opportunity?
Yeah, I think cable franchises are admittedly limited in what they can do, and so cable franchises are effective in communities that, one, just have the ability to be able to negotiate their franchises. There's a number of communities across our country that have state-level franchising, have franchise agreements that last in perpetuity. And so that opportunity is actually taken from communities that have real public input in the franchising process. But I think where communities do, they really should exert that right. And I think where communities don't, we need to work on a state-by-state level to change that policy so that we have more public and local input into the infrastructure that everyone needs.
No, that makes a lot of sense. Diane, I want to come back to you for a second on this whole idea of mobile technologies. You mentioned that in your remarks about looking at rural mobile. Mm-hmm. Should we be technology agnostic when we start to think about getting access out to some of the more remote areas?
I think we should be a lot more technology open, certainly. I also want to say something about mobile, and one of the reasons why I think it's worked so well. National pricing plans tend to work for those of us who are living fairly remotely. So we get the benefit of sort of hotbeds of competition that exist in super densely populated areas, and we get to buy off of those same price lists. That's been a remarkable feature for us out in rural America. And the more that we can do to build on that as a current success, I think we ought to do that too.
Mm-hmm. Any other questions? Because, I can keep going on. I do have one more for Ann. Any other questions? Okay. Oh, you got one? Great. Come on up. And say your name, if you like, and your question.
Can you guys hear me? Okay. My name is Eric Arona, and I'm from New Mexico. I'm actually interning at the FCC this semester. And that kind of has a little of what I have. This might be for Diane, but if anybody else can jump in. We have a lot of Native American tribes, and it's a huge issue that the digital divide affects. And I'm curious if there's anything specifically to that, to Native American tribes that you have to do that is different than just generally rural communities.
Well, yes, because getting the word out is an additional challenge frequently, just because there tends to be a lack of infrastructure there already. So anything that we can do to bolster the infrastructure, and then again, as much attention as we can pay to the community centers. From what we've seen in Montana, we have everything from tribal lands where it seems to be doing okay and tribal lands where it seems to not be doing okay. But no matter where we are, what we do see over and over is the more that we can bolster the infrastructure. And that's an integrated infrastructure too. So I want to point out that we have instances where, for example, we might run fiber in front of the front door of a clinic, but nobody provided any funding for the inside wire or the connectivity of that clinic. So we have to make sure that we do entirely integrated strategies to get the services all the way to where they need to be.
Chike, you want to jump in?
Sure. I would say I think Diane talked about the technological challenges of doing work on native lands. We are doing work right now in Choctaw Nation in Oklahoma, and when we went down there in November, we were able to connect about 200 families. And at the ceremony where we were able to give that out, a woman raised her hand and asked us, "Why are you doing this?" And the reason she asked the question was, frankly, she didn't trust us. She didn't know me. She didn't know the provider. And basically, there is a sociological part of this, which is showing that you mean well, you have the right intentions, and that this is not simply a fly-by-night PR opportunity, which at times has frankly happened on native lands, but it's really about actually closing the digital divide. So that make sure we think about technology and sociology as we work particularly on native lands on the digital divide.
That's right. And thank you for bringing up that question. I think for everybody that is here, this conversation of affordability, it's not just to use Chike's group, everyone on, but everyone connected, right? And we have to ensure that the tribal lands are actually included in that conversation. Okay. We're actually moving to our concluding statements. Oh, I got a Twitter question? Okay, hold on. You got me in a small screen. Which one is that one? Jonathan. Okay, Jonathan, I'm sorry. See, the boss, David, has a question, so we're going to ask this Twitter question. All right, the question coming from Jonathan over Twitter. What about the ongoing affordability challenges and program bundling? How can pricing change to increase access? Thank you, Commissioner.
I mean, just from personal experience and a lot of anecdotes, it's got to be simpler. It's so confusing and difficult just to purchase a standalone internet package with any major provider. And that's a real barrier to consumers feeling like they know what they're paying for and what the value of it is, and also having a more affordable option at the end of the day.
Okay, great. Thank you for that question. Thank you, Twitter World, for engaging with us. we're going to go down the line with some concluding statements, and as Ann does hers, I'm just going to give her a pointed question. You heard everything that everybody said.
Yep.
You know, cities have the big task of trying to integrate all of this, right, and make it work. I know Boston has started this process. I think some of us would never imagine her job title in a city, so that is a first step as an innovation officer. What can cities do? And then bring us to a concluding statement, and I'll have everybody go down.
Well, thank you so much. That's a perfect way to wrap up. Just as Chike talked about leveraging touch points by which people are already engaging with, major public institutions and programs, city government can use its own internal workflows and the day-to-day decisions that arise to integrate principles about broadband and digital equity. So just making a quick list here, and over the past year, and these are not all hours and hours and months of collaboration. This could be, a 30-minute, conversation and, a quick follow-up. We are collaborating with Boston 311, with Public Works, with the Mayor's Office of Resiliency and Racial Equity, Boston Housing Authority, Boston Public Schools, Boston Public Library, Boston Planning and Development Agency, Boston Transit Department, the Elderly Commission. Anything that a city does in the modern era sort of depends upon broadband and digital equity for it to actually result in an outcome that works for all constituents, which is why it really behooves us to make this part of our day-to-day across departments.
Okay. Brian?
So I think one of the things we should remember, consider, and something we found in our own work in Philadelphia is that there's a lot of unlikely allies and champions for this work, and we need to be building the connections and relationships with them. The same groups and organizations that are out promoting civic engagement right now are also groups that could be really great messengers for broadband adoption. Religious and faith communities are such integral parts of cities and communities and rural communities and need to be at the table and a part of the big picture. Labor organizations and other community groups need to be there. We found all those organizations really supported what we were doing in Philadelphia around Comcast and the franchise agreement. And I think Ann's work is a testament to this, that the local and public officials really care too, and taking the real time to educate them, to build their investment in the issues is what allows us to win in the long term.
Diane?
So accessibility, certainly, because we still have large parts of the country that are underserved. Dense population models, understanding that dense population models oftentimes don't work for rural America. And then ensuring that we develop solutions that are integrated all the way from soup to nuts, whether that's all the way through buildings that need access or all the way out into remote places that are hard to get to, all three of those.
People on the wrong side of the digital divide are not victims. They are consumers just like you and me, and we should treat them like that. Each of us wants a seamless, integrated experience when we access any service, and we should provide the same for the folks that we're looking to serve with digital inclusion. What that means is that we need to figure out how do we integrate with their lives, not how do they come to us. So how do we make sure that, again, when someone is having a touch point with city government that's good for them, or with their child's school, or with their library, that we're using that opportunity to get them access to the internet and make it part of everyone's day-to-day. To do that, we're going to have to actually understand the lives of the people we're trying to serve. We have to understand our customers the same way that any type of private sector actor will. And then, lastly, to actually make that final delivery, it's going to require that bigger table that Diane talked about, getting all those people on the page and getting this as part of everyone's day-to-day. So that's not a special thing that we all do, but it's something that all of us do as part of what it is that we do. So thank you.
Yeah, this has been great. Haven't they been great? Let's give them a round of applause. And I just would like to end up, having done my first pitch competition moderation, I just like to end up with just some keywords that we all should leave with, just to make sure everybody here leaves with the same understanding that I did, and mine might be wrong. Affordability, availability, and accessibility, so sort of looking at the 3 A's, and as my 10-year-old daughter would say, make it simple, mommy, and then on the other side, the 3 C's. The fact that we're serving constituents, consumers, but most importantly, citizens. And if we can solve this affordability gap, right? We might actually get to the pie where people actually recognize first-class digital citizenship. Thank you, everybody, and we will proceed to the next panel. I will bring back up... Oh, Dr. Gibbons, come on up to actually take on the next panel. Thank you, everybody.
Good afternoon. I'm going to ask the panelists from the second panel to come on up while I give a few opening remarks here. Take your seats. My name is Chris Gibbons, and I will be moderating the next panel. We've got an exciting group of panelists, and I'm going to allow them to introduce themselves in just a moment. But the focus of this panel, go ahead, sit down. Yeah, sit down. The focus of this panel is the health and healthcare panel, which is a little different, not the lightning round. Not sure why they chose it, but great. That's fine for us.
We didn't want that pressure.
No, I didn't want that pressure. Right. That's right. So the title, the focus, the topic for this one is ushering in the next chapter of broadband health. And just to make sure everybody's on the same page about where that title came from or what that's all about or what we're trying to do, let me give you just a little bit of background. So back in 2009, Congress directed the FCC to develop a national broadband plan. Some of you may have seen it. And this document was to help ensure that every American has access to broadband capability. It was also to provide recommendations for achieving affordability, something we just heard about, as well as maximizing broadband use. There are three basic sections to the report, one on innovation and investment, another on inclusion, and then a third section on so-called national purposes. And there were several of them. A few of them, one was education, another energy, economic opportunity, and obviously one's chapter dealt with health care. In this chapter, the plan took a comprehensive view of broadband in the health space and made recommendations not only to the FCC, but also to the executive branch, to Congress, and to state and local governments. They took a comprehensive view of the ecosystem in the healthcare space, and what that means really is that they thought about broadband networks, yes, but also the devices that run on the networks, the content that flows through the devices, and the applications that were used. And the recommendations focused in just a couple of areas. One, on demonstrating the promise of health IT and broadband, maximizing utilization, closing adoption gaps, unlocking the value of data, and closing the connectivity gaps. So since 2009, significant progress has been made, and despite some important remaining gaps that you heard a little bit about in the first panel, today most consumers are using broadband. In the health space, most providers, doctors, physicians, are using, it's more than 50%, are using broadband in one way or another, and most hospitals are also using it. So at that very, very high level, not trying to sort of sweep under the rug the challenges we still have to overcome, but in some ways we have, it could be said we've achieved broadband health 1.0, or starting things off. But what we're here to talk about today is, what does broadband 2.0 look like? How will it impact consumer health? Will it help improve health care, or will it be totally disruptive of health care? What are the important early trends and solutions? And while you might think that it's easy in this space to think that some of these things are hundreds of years away or 50 years away, let me give you a couple of examples before we get going. Many Americans today are already wearing fitness trackers and smart clothing. Some are taking smart pills. Others are being operated on by surgical robots. Those are not things in the future. Those things are already happening. Others are living in smart cities, driving smart cars, and living in smart homes. And again, to make sure you understand, take, for instance, the city of Yinchuan, China, in northern China, which is today vying and wants to be known as the smartest and most connected city in the world and form a blueprint for other urban and rural areas. In this city today, your face is your credit card. You don't have to go, when you go shopping, you don't have to pull out a credit card. They use cameras everywhere and facial recognition software linked to your credit card. So if you say, I'd like to buy that, you just did. And that's how it works today. Grocery shopping is becoming extinct because, too many foods die on the counters, or they just use an app. Then what you ordered gets delivered to a centrally located refrigerated lockbox that you can pick up at any time that's convenient to you, not to when the grocery store is open. And finally, holograms today are providing assistance to consumers and citizens in City Hall. This is not just about non-governmental services. This is all happening today. So I ask you, soon, if this is happening today, in just a few years, will facial recognition also be able to diagnose depression or mental health problems? Or will holograms make house calls to those who are sick to improve access and improve those who can't get care now? Even virtual reality and augmented reality and drones are being tested in the healthcare space today. Now, while I can't promise that this panel will cover all of those topics, the focus is on the next chapter of broadband in health. So with that, why don't we get started? I'll ask each panelist to come up and give us a brief introduction about themselves, their company, and their perspective, and then a few comments, and we'll move on, and then we'll open it up to everybody else. Why don't we start right here?
All right, thank you. All right, good afternoon, everyone, and thank you, Commissioner Clyburn, for having us here today. My name is Ellis Lindsay. I'm from Nokia. Many of you know us as a network infrastructure company, but that's just significant, but just one piece of what our business is. We've been doing a lot of innovative things in the healthcare space, and I just want to give you a quick overview of a couple of those in this introduction. For us, connectivity is really important, right? It's a foundation of our business, and we've been doing some things with some healthcare providers, some hospitals around the world to help them expand their capabilities and help them improve the way they deliver services. All right, we did a trial with a hospital in Taiwan where one of the doctors in the health bureau is very interested in reaching out to remote and rural communities that have limited access to health services. And so with them and some of our partners, we developed a telehealth solution that allows the health team and the various communities to work together to allow the citizens of the rural communities access to specialists and regular doctor consultations without having to travel, because travel is a huge burden when you're in a remote location. So for us, having broadband connectivity and being able to take these applications and serve these people that have have conditions that are chronic and where they need advice and they need to have ongoing consultations is really important. So in the U.S., we have 117 million people who have chronic conditions, right? Half of those have more than one chronic condition. That's a huge amount of people. And for us, that's something that needs to be solved, right? As a technology company, right, our vision is really to expand the human possibilities of technology, not just do technology for its sake and to connect people, but to make a difference in people's lives, make their lives easier, give them back hours of their days so they don't have to be frustrated and do things that are just process as opposed to being productivity or leisure or getting benefit out of their life. And so in this example with this Taiwan hospital, we were able to save a lot of time for the doctors who would typically have to travel all over the countryside to sit down and have consultations with their patients through video conferencing and links into electronic health records and being able to see x-rays and other private data for those patients. The doctor didn't have to travel so much. The patients didn't have to travel so much. And so they saved a ton of time and increased their general quality of life as much as they could given that current state. And their next stage is really moving on to post-acute care, which is a very significant challenge, right? In In the U.S., I think I saw a number earlier this week that said there's about $62 billion a year spent on post-acute care, which is a huge, huge amount. But not very much of that is directed towards remote monitoring. And for us, remote monitoring is critical to changing the way that healthcare is delivered. Right? We can, as Dr. Gibbons mentioned, a lot of people are wearing fitness trackers. Like I've got one on right now. Tells me how well I'm sleeping. Right? But how much I exercise, I can combine that with other heart rate information, weight information, things like that. And that gives me a good idea of what my health is. And the way that we're working with this data as a company is really to help doctors and patients get well faster by staying out of the reactive healthcare system of patients having to go after an operation or some other medical procedure to a hospital, wait, and get that one snapshot of their health. Right? Through continuous remote monitoring, you have a continuum of data, which provides a lot more information than just that single snapshot. So for us, having that technology-based solution to help change people's lives, to keep people from being readmitted to hospitals after an operation or other procedures, that's critical to having technology change the way people live their lives. So that's a good intro, and hopefully you'll check out what we're doing with our Withings products that I mentioned. That's providing a lot of great information.
What we'll do, we'll just rifle through the panelists, and then we'll open up for questions. So why don't we come on up with our second round.
All right, good afternoon. I'm Carrie McDermott. It's a pleasure to be here today, and I'm an FCC alum. I served as the healthcare director, and I'm one of the folks who co-authored the healthcare section of the National Broadband Plan. So I'm always excited that the Commission is still focused on healthcare, and Commissioner Clyburn in particular has always been a passionate champion for those initiatives. So it's great to see that work continuing. I'm now with a nonprofit called the Center for Medical Interoperability. This is a 501c3 organization founded by health system CEOs to work on their shared technical challenges related to specifically to the fact that medical devices and technologies do not share data effectively. That is this lack of interoperability has implications for patient outcomes. It can undermine care quality. It actually is exhausting our clinicians, and it wastes billions, upwards of $30 billion a year to our health system just because medical devices don't talk to each other. So we have come together in this organization to focus on three things: infrastructure, innovation, and transformation. Regarding infrastructure, we're working to set up a reference architecture for healthcare. There is no master blueprint for how all these different devices and systems should fit together. And there's no reason for it to be done differently because this is the basic plumbing of healthcare. We're not the sexy value-added bit. We're the plumbing. And the plumbing, like any utility, should be consistent. So we're focused on how do we shore up the technical underpinnings of healthcare such that we actually have a stable foundation upon which to innovate and then drive the clinical transformation that our country so needs. And so, one of the things we really focus on is data liquidity. And by data liquidity, I mean that patient information can move freely and securely from the point of care, and that's whether the patient's in a hospital bed, in a doctor's office, or in their home, in their car, somewhere in between, to wherever that information needs to go. Sometimes we need that information to make it into your electronic health record. Sometimes it needs to be sent to a big data analytics engine. Other times it might be needed in a public health registry. Or maybe you just want it to actually populate your own personal health record. Or maybe Ellis's doctor wants to know what that Fitbit is saying about his sleep. That should, with your permissions, really move securely. So to have data liquidity, we actually need the infrastructure to support it. And that's why I think it's so important, the infrastructure of healthcare that the Commission is positioned to support. When I do my kind of, Maslow's hierarchy of needs of healthcare delivery, infrastructure is at the bottom. Because if you don't have the wired and wireless available, you literally cannot exchange the data. Without the pipes, it won't move. So it is so core to the foundation. And that's why I encourage us and the Commission to keep doing everything it can to make sure that we are improving that infrastructure, especially in rural areas. I'm coming at this from a health system perspective, but, an earlier panel, was it Diane? Yes, Diane spoke so eloquently about the challenges in rural communities for individual consumers. Well, their institutions are facing the same ones. So we need to make sure we are getting broadband to all of those anchor institutions, that we are protecting the proliferation of wireless. I know there's been work around Channel 37. What happens when we have all these wireless devices suddenly encroaching on the space that healthcare used to use for real medical delivery? We need to work to make sure that we are, maintaining safety and controls around that. I will leave it there, but I just really want to focus on infrastructure. This country thrives on having robust wired and wireless. Thanks.
Thank you, Dr. Gibbons, and thank you, Commissioner Clyburn, for having us here today, and appreciate the opportunity to speak on these matters. Again, my name is Finley Davis, and I am a program strategist at C-Spire. We are headquartered in Ridgeland, Mississippi. My primary initiatives that I focus on are the expansion of telehealth. And I would specifically, in this very brief period of time, like to talk to you about the pilot program that we recently completed in the rural Mississippi Delta. We partnered with the University of Mississippi Medical Center Center for Telehealth, the State of Mississippi, Sunflower Medical Center, and Care Innovations, and we were able to do this medical research pilot focusing on type 2 diabetes among a 200-patient group. This is specifically focused around remote patient monitoring and how it really changes the lives of people. It alters their habits. It not only is life-changing, but it is cost-saving as well. Just to name a few things very quickly, in the first 6 months of the pilot, we have to note that despite the fact that many of the participants did not have the capability to read beyond a 6th grade level, and they had never used an electronic device before, they were thriving in this program. They said that they felt, which is astonishing, that in 2016 for them to be able to say for the first time they felt like their condition was under control. They felt better, their quality of life was improved. I could go on and on about their A1C levels, how they were lowered, but really what it boils down to is in a 6-month period, we were able to save roughly $330,000. And unfortunately, the population in Mississippi is rampantly affected by uncontrolled diabetes. So if we applied that savings that we were able to accomplish in a 6-month period with only 200 patients to just 20% of the uncontrolled diabetic population in Mississippi, that looks like $189 million in savings. And I'm so proud, to stand here and talk about those potential savings and what an impact remote patient monitoring can make on individuals in rural America. UMC and C-Spire are ramped up to, increase these initiatives in other portions of Mississippi. Again, just 6 months into the program, we realized this didn't just need to be a pilot. This needed to be a full-blown program so we can serve our individuals in the state better. It's critical, though, and I think the foremost concern, kind of what the other panelists have touched on so far, is that being able to replicate the success for life-changing and cost savings, it would be impossible if the communities were not well-equipped with the same connectivity that Ruralville was. So I hope we can expound on that a little bit more as we move forward, and thank you again for your time.
Good afternoon, everyone. Am I allowed to do a pitch as well as make a few comments? I can do it? All right, thank you. My pitch is not going to be 2 minutes, it's going to be 2 questions. Question 1, how many of you in this room don't have your mobile phone with you because you've lent it to your husband, wife, partner, or kids? Question 2, all right. Question 2, why is Lifeline a one per household program? If we believe in bridging the digital divide, is it just one person in a household or is it everybody in a household? There's my pitch. 2 questions, not 2 minutes. Now my comments. So I'm responsible for running a company called Voxiva. We're a healthcare company that happens to use digital technology to deliver services to people. And we do it at scale. Over the last 5 years, we've reached about 2.5 million people with our various programs. The sorts of things that we do are really rather rudimentary. In many respects, what we're trying to do is get people to do the things that they know that they should already do. We work predominantly in Medicaid, with the Medicaid population, and they're struggling with all sorts of different pressures on their lives. So remembering to get their kids vaccinated, get their own flu shot, go into preventative care, get screened for breast cancer or cervical cancer, have a body mass index assessment, and then discuss nutritional requirements with a trained professional. Those are things that people just struggle to remember to do, but they know they do. And so a lot of what we do is using very simple technology, text messaging. We take information and data from the healthcare system, predominantly from health plans, but sometimes from healthcare providers, and we work out a personalized program of care, and then we deliver that information to individuals largely through text. And we've developed programs around maternal health. We have a program called Text for Baby, which was something of a public-private partnership with the government and many organizations in the healthcare industry. We also have a quit smoking program, which is now available in about 26 state quit lines. We have a program focused on diabetes, and we have, a whole variety of components focused around preventative care. About 3 years ago, we teamed up with a Lifeline service provider, and we figured out that Lifeline service providers have one huge challenge, which is promoting their offers to the market. As one of the panelists from an earlier session described, one of the challenges is just letting people know about this benefit that's available to them. So 3 years ago, we teamed up with a Lifeline service provider who wanted to promote their services to Medicaid beneficiaries. The problem was healthcare organizations can't just open up their patient databases or member rosters and say, here's a free phone. So instead, we bundled our services together with Lifeline to create what is, in a sense, a health phone. And we've been responsible for them promoting that capability to health plans and their members. And over the last 3 years, we've reached about 1.25 million people through that program. That's about to get much better. With the Lifeline reform that the FCC and Commissioner Clyburn has spearheaded in December of this year, we obviously see that program transition much more towards a broadband era. And for the first time, the subsidy will be applied to data services as well as voice services. And so in partnership with the Lifeline service providers, early next year, we're basically going to be upgrading dramatically the services that we provide. So no longer will they be purely text-based. Through the Lifeline model, we'll actually be preloading applications on mobile devices that will allow people to have telemedicine consults remotely with a physician to access data on their own health, data that's collected and collated through the systems that we can tap into. Chat with a nurse, 7x24. By the way, that's a feature that most health plans offer you today, but it's mandated in Medicaid. So we're going to be opening up the capability for people to ask questions of nurses and get responses. And, of course, continue to receive those health prompts and reminders. So that's how we're thinking about leveraging the push and the move into the broadband world with Lifeline. That's revolution. That's evolution, not revolution. Revolution would mean solving some of the problems that we've heard discussed here today. Rural America is where a lot of people living in poverty actually reside. And with 22 million people living in areas where broadband isn't available, that's an issue that has to be addressed. Then there are some regulatory issues that would make the lives of those of us in the healthcare industry trying to satisfy and solve patient problems or member problems easier. So looking at the Telecommunications Consumer Protection Act to figure out where that can be made more consumer-friendly and healthcare system-friendly would be another example of something where I think people in this forum could actually play a role. So those are some of the things I think that are important as we start to embrace the broadband world in mobile health. Thank you.
So let's give an initial round of applause. So I just want to remind everybody, this is the part where everybody is able to pitch in. We have microphones on each side. If you can either go to the microphones or they'll bring them to you. We also have cards on the seats. You can write questions down and hand them to the edges, and they'll be read. For those online, the hashtag is Solutions2020. Use that hashtag and ask your question. It'll come directly to us, and we'll get as many of those as possible. So now you know a little bit about our fantastic panelists and what they're doing. We see we got people lined up. Why don't we start with the commissioner?
Thank you, Doctor. I just wanted to ask us, inspired by a question I saw from Jonathan, who's pretty active today online. Talking about regulations might be a little unfair, whether or not the right regulatory construct is already in place to realize some of the things that we're talking about. Are we keeping pace from a regulatory standpoint, from your points of view, with the pace of change and that's facing us? Are we keeping up? Is there regulatory lag? Just wanted to get your perspectives on that.
Anybody want to take that? No?
I would love to, but Kara's going to go first.
Apparently, yeah. No, I think it depends on the specific issue. So as you brought up, the ability to actually have Amazon notify me that a package is coming is great, but I have to go through a whole separate set of loopholes, whether it's CVS notifying me about prescriptions or to get some proactive outreach from clinicians. That could be good for my preventative health. So I think and you probably are better versed in this, Justin, than I am, but I do think that is an important issue within the Commission's scope that you can look at to say, how do we do a better job of making it easy for people to grant the consent to be recipients of the healthcare information or health beneficial services and whatnot. From the hospital perspective, and I'm not an engineer, obviously, but they are very worried about what's going on around Channel 37 and spectrum that used to be around the wireless medical, technology services. So as we continue, and the FCC has always been really good about working in partnership with the healthcare community, but I'd like to make sure that, those engineering bodies stay connected to really understand how opening up the spectrum is actually affecting play real time, because it's important to get more available and more folks using more devices in different ways in different places, but we want to make sure that we're not disrupting things that are mission critical or patient safety critical. So I think just maintaining the dialogue there.
And just before Justin adds in, I'll jump in. It's not just the license ban for medical devices. Most of your apps and other things that are being developed outside of medical devices are proliferating in the unlicensed ban. And so you don't have any protections there. And what happens when those things start interacting with everything else? So there's issues there. Justin.
So anyone that is trying to solve healthcare problems using digital technologies and mobile-based technologies has to worry about three different categories of regulation. Of course, there are the FCC regulations, and for us, we worry a lot about the Telecommunications Consumer Protection Act. We don't want to spam people, but we also want to make sure that people get the data and information that they need to make informed decisions. So the TCPA is one element. HHS clearly has a whole set of concerns and regulations around privacy. You all know about HIPAA, that little form that you sign when you go to a physician's office, but HIPAA is obviously far deeper than that, and protecting patient privacy is vital. And then the FDA, you mentioned this yourself, Chris. The FDA has all sorts of regulations around mobile medical devices, mobile devices that connect to systems that have the potential to control human function. And so we've got three different elements that we're worrying about every day as we build solutions. All of those are really important. Even though they drive me crazy when we're trying to figure out how to do something, they're also incredibly important to protect the consumer, both their privacy and actually their health. But I think, there are sensible reforms that could be made. The one area that I think has made a lot of progress over the last 18 months has been the FDA essentially stepping back and saying there are a whole series of devices that we're not going to regulate. They didn't actually declare them unregulated, but they simply said we are not going to actively regulate these devices. And I think that's been a big positive step forward. But there are definitely other reforms. The TCPA would be my greatest desire to see some rethink about how to protect the consumer from spam at the same time as allowing organizations that need to communicate with people to do so.
Anybody else want to?
Yeah, sure. I'd just like to add into those the privacy concerns there, because obviously that's a very critical piece. And as we're evolving into really a state of consumerization of medical devices, right? That's really helping individuals adopt these devices to use them in their everyday lives to get healthier. And so for us really having more spectrum availability to have these devices connect over a licensed cellular band it adds a level of security, because if it's just a close Bluetooth connection, there's no real security there. If it's Wi-Fi, there's no real security. When there's more low and medium band spectrum made available, which will address more rural areas, then we'll be able to have greater secure connectivity between these consumer devices that are feeding into the HMOs and healthcare system.
Good. Thank you. So I think this question is a good one. Are policies keeping up? And not to add to what they're saying, how many of you have heard of Moore's Law? So Moore's Law, yeah, most of you know, was first cited by Gordon Moore, the head of Intel, and he basically was the observation that computer chips are getting much more powerful very, very fast. In over about two years, the processing power of chips doubles. And so that's been our cycle. Today, one computer chip holds about 3.3 billion transistors. So what that means is, our cell phones are much more powerful than big, large computers we had in the 60s. Combine that with the networks, and that rockets ahead what we can do. So some of these things we were talking about might have in the past taken 100 years to get there, but today it might be just 3 years or 5 years. So is policy keeping up? Probably not, but it's really, really hard. All right, we have somebody else at the microphone.
Hi. Recently, a federal government study, $25 million study, 16-year study of the National Toxicology Program has established that wireless technology radiation is causing brain tumors, heart tumors, neurological problems, and even DNA damage. This study has actually joined many thousands of studies which proven that this technology is also causing heart problems, autism, ADHD, diabetes, and a condition that I'm suffering from, which is called electrosensitivity. My name is Daphna. I'm the head of an organization called We Are the Evidence. It's an organization that represents adults and children, and many children who have become very sick from wireless technology radiation. And we're not talking about negligible group in the population. Just from my condition, which is probably 10 to 20% of the people already have symptoms, whether or not they're aware of it, including Nokia, Chief Operation or Technology Officer, who also has become electrosensitive. And as I said, so the harms are not potential; they're actually existing, and they are in epidemic scale. So my question is, don't you think it's an absurdity to develop all kind of alleged health system that are actually causing the same conditions that they are supposed to monitor? And just as an example, essentially what you're doing when you're developing this kind of technologies is it's like putting sugar in the drinking water and then treating people for diabetes. So I hope that Ellis from Nokia can answer that, or anyone else who might be interested.
You want to go first?
Well, I'll give it a shot. I'm not an expert in wireless technologies, but I've not read any of that research. I haven't seen any of that, so I can't.
Don't you think Nokia, when it's developing this technology, should learn about the harms that this technology is causing? And by the way, Nokia headquarters is aware of it, as well as every other wireless technology company. When you develop 5G technology, don't you think you should learn about it?
So maybe as the only, I think I'm the only physician up here. Am I the only physician? Let me give you a shot. I think this is a concern that many people have, and on that basis alone should be something that we should look at as a society and decide what we're going to do. I'm not sure. My understanding of the scientific literature is not what you've said. I'm not aware that there have been thousands of studies and that has been conclusively shown and proven. That's actually a word we use pretty rarely in medicine. There are very few things that are actually proven. So we might be on a different page there, but I think it's a significant concern that many people have. It has been looked at a lot, and we should continue to look at it. Everybody should. I mean, to the extent that innovative companies are looking at it, yes, the government should look at it, and we should move forward where the evidence does suggest that we go. Thanks. Yeah, next person.
Hi, Lolita Forbes with Samsung. I promise this will be an easier question.
That's all right. That's all right.
Folks can answer. So I agree with Justin that the FDA has done a lot in terms of looking at mobile medical apps and coming up with buckets of things to regulate and things based on their low risk profile to allow the industry to flourish. I agree also that HHS OCR has done a lot of work around HIPAA, and the FCC has done its part in terms of making spectrum available to the wireless industry. My question is around reimbursement. And last Friday, CMS released a final rule regarding MACRA, and the Act had identified remote patient monitoring and telehealth as two initiatives that should be included in MACRA as ways to incentivize the transition to value-based care as away from fee-for-service care. A lot of us in the industry have advocated for changes in the rulemaking to address that requirement in the Act more directly, to more incentivize doctors to be able to receive reimbursement for that type of activity under MACRA. Interested in the thoughts of any of the panelists. I don't know if it's critical to your business plan or not. I know that UMMC, in partnership with Ceasefire, has funded some things on their own, as well as done the state Medicaid reimbursement, but wanted to get the panel's thoughts on the impact of reimbursement at the federal level through MACRA and CMS's final rule.
Anybody want to take a dive?
Do you want to go?
Yeah, that'd be great. Thank you for your question. And yes, that is true that UMC, the Center for Telehealth, and Ceasefire, thanks to legislation that we have in place in the state of Mississippi, and being one of only 7 states that is currently reimbursing for all 3 types of telemedicine, that's one of the reasons that programs like this are possible, so we can impact positively people's lives. So I can't speak as much on the federal side, because right now Medicaid really is the driving factor that is reimbursing, that, like you said, is positive reinforcement for physicians to see the benefits, and adapting to new technology and new ways to adapt to medicine. So that's been a major factor in moving forward with technology.
Yeah, so CMS is certainly looking hard at the whole domain of telemedicine and trying to figure out what's right and what isn't to do. You know, in the absence of enormous amounts of evidence demonstrating that telehealth reduces health care costs and improves health outcomes, it's obviously going to be somewhat cautious. But now 48 states under Medicaid allow some form of telemedicine. And furthermore, the U.S. government, in terms of the systems that it operates to deliver health care, such as Veteran Affairs, are really starting to embrace these new technologies as a way of connecting people to healthcare providers remotely. It's really early days in the world of telehealth. I mean, telehealth, in a sense, has been around for a long time, but the use of now video-based technology to connect an individual to a physician is still early days. But I think everything's moving in the right direction. CMS opening up Medicaid more and more, rural health populations being given access to reimbursement models to allow for telehealth. Those are all steps positively in the right direction. But as Chris mentioned earlier, the healthcare profession is very, very evidence-based, and it wants to really see that these types of technologies are going to have a really significant impact on cost or quality before really letting the floodgates open.
I'd say I absolutely agree with that last point, but I also like to broaden the framing of the remote monitoring and telehealth. You say it better. I love that, telehealth. As a technology, because it's really also about convenience and another way of reaching and engaging the patient population that you treat. So it's meeting your customers, the individuals for whom you're responsible, where they are. And it may not matter whether the clinical quality or cost savings are proven, as long as it actually helps you drive engagement, because there'll be a trade-off somewhere else in that, total equation that you have with that patient. So I think we're all always encouraged when the government takes steps to make it possible to be compensated for using those type of services. So keep on them.
I think the panel is absolutely right, but keep in mind the future is going to be even beyond that. I mean, what happens when algorithms are programmed to the system to work automatically, right? It doesn't even need a doctor, right? So I think, this is a little bias of mine, in the healthcare space, we limit ourselves too much in terms of innovation based on what we can be reimbursed for. Basically saying, I'm not going to think about innovation until I can figure out a way to get paid for it. I think we should figure out what works best, and then we will get paid for it because it works best, right? It sort of makes sense. And just one quick example. I mean, you heard the Tesla example. A guy was driving his car. It was in the paper about 3 months ago. Suffered a pulmonary embolism while driving on autopilot, or he switched it to autopilot, and basically the car navigated him autonomously to the hospital, almost to the hospital. I mean, that's what the future will increasingly be. That's the first time that's happened. Was that telehealth? It used telecommunications equipment to transfer information to help that patient. So we
one
have
quick
to,
response to you.
Yeah.
That sounds like powerful clinical decision support, which will be regulated by the FDA as a medical.
It actually wasn't, though. All right. So do you have a question? Are you? No. Oh, you just stand up. Okay. We've got one from the internet here. We've sort of touched on it a little bit. Oh, man, we got two questions. This is really about privacy and security. As we're working to make data flow more, what's being done in the privacy and security of that data area? Anybody want to take a quick stab at that?
Yeah, sure. So with the solutions that we're working on, right, we are primarily an opt-in. Right, people specifically go and they buy our devices and they agree to the terms. But we're also working with a lot of companies. So as part of their corporate health plans, they may be incentivized to use these wellness devices. And as a result, communities are getting a very clear view from an anonymized level of what their community health status is. Right. So we're doing that with maybe 25, 30 companies around the world right now, and it's actually giving us a really good view out of that's very private. There's no individual data allowed, and everybody is opting into that. So in the U.S., we have over 100,000 users who are contributing to this data, and we have maps that are publicly available showing which state is the most active, which state has the highest levels of hypertension, things like this, correlating all the data in a very private way. So it's, for us, really starting with an opt-in model so that people understand that they're contributing to a greater purpose is very worthwhile.
Great. Anybody else? Any comments?
I'll just add that cybersecurity is a paramount issue for health system executives. So my board of directors met recently. Collectively, these CEOs represent over 15% of the healthcare market. That's over $100 billion of purchasing power. And they're committed to make sure that their investments in patient technologies absolutely account for the cybersecurity piece. I mean, they're worried not just about the personal information getting hacked, but about those actors who would try to do ill unto patients in their facilities by hacking devices. So I think there's been more scare around that. The probability of something happening is greater than zero, but the question is how much more. So, take the nuclear power industry. The probability that something could go wrong, yes, it's greater than zero, but let's appropriately quantify and protect against. But cybersecurity is only going to get bigger.
Great. We've got less than a minute left, so why don't we end by having each one of our panelists take 10 seconds to tell us what does good look like? If we're perfect, we've made it, we've done it in this world, what would that look like to you from the perspective of you or your company in the health space? Not to put anybody in this spot. Whoever wants to do it. I was going to do everybody, but anybody want to respond to that?
Start at the other end.
Yeah, okay.
Sure. I mean, specifically speaking from a telecommunications standpoint, and this pilot specifically and others that we want to implement, without the Universal Service Fund support that we receive to serve these areas, all of the basic fundamentals that have been mentioned today cannot penetrate rural America. So in a perfect world, my definition of success would be no reduction in USF support.
Great. Anybody else?
I was going a different direction. I had the seamless flow of information to improve healthcare for all.
Great. Dustin, anything?
I think change needs to be thought of very much in the context of what is safe to do. We talked a little bit about regulations earlier on. And while regulations drive those of us that are trying to do things nuts, they're also there for a very strong and powerful reason. There are many things in the world of healthcare that just have to be treated incredibly carefully and sensitively. So,
great.
Change safely.
Sure. And I think just adding on to these themes is really that it's a very complicated world. And so having companies work together to try and solve problems in more of a co-opetition ecosystem kind of manner is going to help us move forward much more quickly.
Great. Please join me in thanking our panelists for this session. Yeah, that'd be a good idea.
Good afternoon. So as the panelists are coming forward, we're going to go ahead and ask everyone to get situated.
Hello. How are you? Pleasure.
Paul, how are you? Dave Howard.
All right. How are you? Monica Martinez.
I'm Paul Wright. How are you?
Hi, Paul. Monica
How are you,
Martinez.
Dave Howard?
Nice to meet you.
Hi, Paul Wright. How are you? Pleasure meeting you.
Got about a minute. Sure. Okay. So we want to remind everyone that there will be a break after this session. And so I used to be chair of the Florida Public Service Commission. I don't have a gavel here, but if I did, I'd be banging it right now. So All right, so this session is dealing with combating inequality in the communications sector. And it's interesting that in my day-to-day activities as a Florida commissioner, one of the things that we always are concerned about is access for everyone, and particularly as we have just come through a storm down in Florida, Matthew, ensuring that every sector of our population has access. And today we have a panel that is going to help us talk through some of those issues as to how we ensure that every sector has access. We talked about in a few panels before, talked about affordability, but today, right now, we're going to focus on access. So we have some experts and advocates who will help us navigate through this topic. Now, here are the rules. Just a reminder, we're back on the pitch sessions. So they will provide 2 to 3 minutes of a pitch. After each one of them has the opportunity to provide the pitch, when we're done with their pitch, then the audience will have an opportunity to ask questions, 30 seconds per question. So please don't provide a dissertation in the process, 30 seconds, and I will cut you off if you're above the 30 seconds. And at the end of the round of questions, we will give each one of them about a minute to sort of give their closing or parting comments, and then we'll go into our break. So to help us go through our discussion this afternoon, we have Loris Taylor, President and CEO of the Native Public Media, and she's from the Hopi Nation. Did I pronounce that properly?
You did.
All right, good deal. Then Monica Martinez. I know Monica from Michigan. We served together as she's a former or recovering commissioner. She's an advisor to Mobile Future, and she's also founder and CEO of Rubin Strategy Group. And then we'll hear from Paul Wright, founder and executive director of Human Rights Defense Center. And then we'll hear from Dave Power, President and CEO of Perkins School for the Blind. And so they're going to help us navigate through some of these issues that are important to all of us. And I want to remind you that you can either write your questions on the cards that are near your seat or on your seat. Hopefully you're not sitting on it. And you can tweet a question at hashtag solutions 2020. So those are the ground rules. And so with that, we'll turn it over to Loris. And you feel free to come up here.
Lomata Lengva, thank you so much, Commissioner Clyburn, for this opportunity to speak on tribal priorities. And I have 5 priorities and solutions for you today. Number 1, deliver us from darkness. Spectrum for Indian Country is paramount and has been since the FCC's earliest work with tribes since 1999. The FCC's tribal policy statement recognized this need in 2000. The spectrum is a resource need for obvious deployment, but also one that will bring more investment opportunity to tribes. Tribes simply need spectrum, and I urge a tribal priority for spectrum allocation. Number 2, tribal governments deserve better treatment. Give the FCC Office of Native Affairs and Policy its own separate and specific budget and a direct line to the 8th floor of the commissioners. The Commission's annual struggle of setting a budget for ONAP must stop. Without a budget, there simply is no tribal consultation. Number 3, high-cost reforms must include Indian Country. The increased costs of deployment and maintenance in Indian Country requires the reinstallation of the tribal variable and the adoption of the tribal broadband factor. Number 4, Lifeline and LinkUp are about affordability, not infrastructure. It is the one program that has positively affected all of Indian Country. And number 5, maintain the voice of tribes in the review of tower siting processes and other infrastructure. The involvement and consultation with tribal nations on very complex and sensitive subjects need better transparency and coordination, which consultation provides. The FCC's leadership in these sacred sites preservation processes with your massive online systems should work to remain so. And I thank you so much for this opportunity.
Thank you. Come on up, Monica.
Hi, I'm Monica Martinez, an advisor with Mobile Future, a coalition of cutting-edge technology and communication companies and a diverse group of nonprofits. We've done work in this area and have taken a look at studies across the sector. Mobile is a game changer. 70% of African Americans and 71% of Hispanic Americans own a smartphone, essentially a mini computer in the palm of their hands. Latinos, Hispanics are super users of mobile technology, over-indexing on social media, mobile online purchasing, and video streaming. So yes, African Americans and Hispanics are among the most active and engaged group of consumers on wireless technology. But they lag far behind in the participation of the $548 billion in mobile innovation that contributes each year to our U.S. economy. At roughly 7 million jobs, there is a growing need for talent. We need to continue to keep mobile as that game changer. Yes, mobile has accomplished much for consumers, but we need now to be thinking about it as economic empowerment. So we need to focus that attention on that. So let me give you an example. When 59% of African Americans in a recent survey we conducted viewed mobile as primarily as a consumer tool and only 24% as an economic tool, that means we have work to do. When women account for only 5% of tech engineers and startup founders, and when Latinas represent less than 1% of those with degrees in computer and info sciences, we have work to do. When those who are graduating with degrees in computer science and engineering, 4.5% are African American and 6.5% are Hispanics, we have work to do. The solutions, yes, it's multi-pronged. We need to focus on talent and entrepreneurship. We need to boost personal exposure to mobile technology industry to individuals. Over half of African Americans in our recent survey said they did not know someone in the technology industry. But when they did, it boosted their interest in a mobile technology career by 33%. And it boosted their likelihood of being interested in being a mobile entrepreneur by 56%. That's critical. At the same time, we need to boost information to both students, families, and other influencers. For Latinas in particular, a key driver for the influencers for the decisions they make for careers and education choices are, in fact, their parents. The last is training on mobile entrepreneurship, mobile business training with non-tech jobs and other things. Mobile can be economic empowerment for these communities, and we need to make sure that it's a tool. Thank you.
Good job. Paul, go ahead and come on up.
Thank you. I'd like to thank the Commissioner and the Commission for inviting me to speak. I guess unlike Monica, mine's a little bit more downbeat in that we have 2.5 million people in prison on any given day, or jails in this country. We have 11 million people cycling through our jails annually in this country, and well over 1 million children with an incarcerated parent in this country. And these are people who don't have access to telephones except through highly monetized systems controlled by a handful of companies. No one else in America is paying $14.95 for a 15-minute phone call. That's what the families of prisoners in the Kittitas County Jail in Washington are paying, and that's just one of the examples that we have. This is a situation where we have a case of pretty much total market failure, where the market has not done anything to lessen costs for consumers. If anything, these very same twisted market forces have actually created higher costs for consumers and given them less choice. where the consumer is viewed not as the person who's actually paying the bill, but the detention facility that controls access to literally the captive audience that can then be monetized and forced to use these services with no alternative. It's an egregious situation, and the FCC, under the leadership of Commissioner Clyburn, has finally taken long overdue action to try to address these issues, but the inequality still remains. And at this point, I think that it's fair to say that prisoners and their families are the ones who are paying the most for probably the worst telecom service in America. And it's a very disenfranchised population. A few years ago, I think we all remember when Verizon said they were going to start charging consumers, I think it was $2 a month to pay their online phone bill. Within days, the public outrage that spurred caused them to back down. Yet today, prison telephone providers like Global Tel-Link and Securus, they charge prisoners and their families up to $3 to pay their phone bill, and then they only allow them to pay $25 or $50 at a time. Who else is paying for the privilege of paying their phone bill? And on top of that, they require consumers to prepay their phone bill before they even actually incur the service. And then on top of that, they pocket the money in the event the prisoner is released or the consumer doesn't actually use that time. This is a type of inequality that has festered for far too long. And so far, the FCC is the only agency in America that's shown the courage and the leadership to try to address this problem. And I'd like to thank Commissioner Clyburn for her leadership on this issue, for trying to address it. And so anyways, my simple solution is that we need real competition in the marketplace, and that competition would entail allowing consumers, the people who actually pay the phone bill, not the people with the guns who control and cage the prisoners and monetize access to their families and their loved ones, allow the consumer to choose the carrier that they're going to choose to carry their phone calls and allow them to communicate with their loved ones. Otherwise, this is the most invidious tax. It's a tax on love. You're paying a tax if you want to talk to your loved ones in prison. Thank you.
Well, Commissioner, thank you for inviting me to FCC Meets Shark Tank. How many of you would be willing to give up your text messaging capabilities on your smart devices? Okay, no hands are raised. But for many Americans who are deafblind, we're asking them to operate without effectively text messaging. It's a problem we know something about. The Perkins School for the Blind is the first school for the blind in the United States, the first to educate an individual who is deafblind, and the alma mater of Helen Keller, one of the most famous deafblind individuals of all time. And our mission is to help young adults, prepare them for college, employment, engagement in the community, and make the world more accessible. And we're big believers in innovation and technology to get there. We've been working with the FCC to distribute communications equipment to deafblind citizens across the U.S. Just last month, we helped broker a relationship between Uber and Lyft and the Mass Transit Authority to allow paratransit services to be available through on-demand, like smartphone-level transportation services, which is a big breakthrough. And also last month, we announced a new mobile app funded by Google to help people who are blind find the bus stop, which is harder than you may think because of the inaccuracy of GPS. The problem here is that for those people who are deafblind, who are native ASL users, in other words, American Sign Language is their primary language, not English, and who also use Braille, it's impossible to use text. It's way too hard. There's too many layers of metadata without getting into too much technology. And so what we need to do is do kind of a design project and look at how we can erase some of the layers of coding and make that text much more accessible for people who use this phone and connect it to a Braille accessibility device. It's software, it's doable. We need to partner with the platform vendors of iOS and Android, and it's a very solvable problem. So thank you very much.
All right, so I want to thank the panelists for staying within their time frame. Trying to see if there are any questions from the audience before I begin to ask questions myself. Okay, so I'm going to start with Loris. So you mentioned the need for spectrum. What would that solve? from your perspective?
Well,
And how do we get there?
Well, I think one way, well, first of all, tribes, the digital divide in Indian country is so wide and so deep and so pervasive that it will require an added additional effort to close that divide. And one way to close that divide is to consider the adoption of a tribal priority for spectrum allocation. I think one of the speakers earlier said that if you don't have the infrastructure or the pipelines, you really don't have anything. And in Indian country, according to the latest report of the FCC's Broadband Progress Report, 41% of Americans living on tribal lands lacked access to broadband. Of that, 68% living in rural areas of tribal lands lacked access to broadband. So it's a huge issue. And one other way to address that is to work individually with tribes. One size does not fit all. There are 567 Native nations in this country with different jurisdictions, with different issues, with different rates of poverty. And so by working individually with these nations to come up with a broadband blueprint is really something that we advocate for. I just came from the National Congress of American Indians conference where tribal leaders define tribal consultation not as a process of checking off a checklist or not as communication by text or email with an individual within the tribe, but a more structured approach that brings parties together to determine how best to deploy broadband out onto tribal lands. So it's a more structured, more focused, more deliberate process that tribes are seeking. And it's what tribes are really saying is that we can find our own solutions to close the digital divide, but we have to be provided that opportunity to come to the table.
Thank you so much. So, Monica, you sort of couched the issue of inequality with respect from the perspective of economics. And so would you address that issue, the importance of pipelines and creating the entrepreneurial environment and how mobile can play a role in that?
Absolutely. I mean, when we think about mobile technology, the fact that many of our communities, the African American community and Hispanic community, have that familiarity, it's already a step ahead in that direction. So when we think about some of the things, when we think about within our communities like small businesses, Latinas are leading in the small business entrepreneurship across the country. Adding in wireless and mobile technology is so critical for the success or failures of businesses. Mobile Future did a study with the United States Hispanic Chamber of Commerce 2 years ago, and they found with small businesses that mobile technology helped lead to greater efficiency, upwards of 62%, and greater access in terms of growth of those businesses, in terms of 83% of increasing growth. This is a big deal. This means that mobile technology can make a difference and be a game changer for entrepreneurs.
All right. Thank you. Just want to remind the audience that if you have questions, feel free to write them down or go up to the mics and ask the questions yourself. If you're a little shy like I am, you're welcome to go ahead and write the questions down, and I will read the question for you. Or you can tweet it at hashtag Solutions2020. So, Paul, you talked about the human impact associated with the level of rates associated to those who are incarcerated. What are states and the federal government doing to address those issues? Because they're disparate issues as states look at it and the federal government looks at it. They are looked at very differently. So can you address that issue?
Yes, I mean, one of the things that we've seen in the past 30 years of prison and phone justice issues is this whole commission-based system where the companies pay a kickback or a commission to the states or the jail in exchange for their monopoly telephone contract is one of the drivers of this. But of course, there's no rule or law that says they have to take this money. And some of the states, but the other thing, the bad thing is that generally it's always been some external factor that has caused the states that have rejected the commissions to do so. In New York, it was the governor who signed an executive order forbidding the state from taking kickbacks, and that lowered their rate to one of the lowest in the country. So the phone call in New York today is 5 cents a minute, which is much lower than elsewhere. In New Mexico, the Utilities Commission enacted reform capping the rates as well. Missouri and a number of other states have as well. At the local level, we're only aware of 2 sheriffs out of 3,200 that have sought low rates. So, and the federal government, they also haven't really taken except for the FCC, they've not really taken a position on this one way or another. So at some level, some of the states have taken good positions on it in terms of trying to establish some level of control. One of the problems that we find is that in some states where they've deregulated their telephone industry, there is no state-level regulatory mechanism to control the prison and jail phone rates, even if the political will was there.
All right, thank you. So, Dave, you talked about some coding changes that need to happen in order for greater accessibility, but I'm going to ask you a question. What are some of the ways that people who are deaf and blind can gain access to accessible communication devices?
Well, I mean, there's a program called ICANN Connect, which is sponsored by the FCC. I mean, Perkins is one of the partners that helps distribute certain communication equipment that a person who's deafblind needs. And it's not easy to reach and find that population. So, I mean, I think that's been a very successful program for doing that.
Okay. I see that we have someone standing at the mic.
Yeah, I just have a quick question. Nicole Turner-Lee from MMTC. So you talked a lot about the consumption side of inequality, right? What happens when people can't access, if they live on a tribal land, or there are people who are overusing in mobile, people who are incarcerated, or people who have a disability. I'm curious about the production side. Do we need to flip the equation and get some more indigenous people and people with disabilities and people who have experienced impact to actually create some of these products and services that could actually foster and cultivate adoption and actually get through some of the inequalities that we're actually seeing on the consumption side?
So I'll let Dave start, and then we'll.
Yeah, I think one of the things, and we're slowly moving to this, is the notion of designing accessibility into products and services in the first place, rather than retrofitting them. It's very expensive to do remedial work, but I think if all designers, engineers, architects, etc., learn to build accessibility in, it saves a lot of trouble.
Monica.
I mean, I think that's the point of my comments, is that as mobile technology users, these communities have shown that they can be a very adept consumer. So they can go ahead and do that. So we need to make sure they're on that economic empowerment side. They need to be the talent in the jobs doing some of these things. They need to be the ones designing the mobile apps that affect their communities. We need to be using that and thinking about that side. We need to be boosting it up, that entrepreneurship. So it really is, as a consumer, if we're spending and using that part of the industry, we also need to be on the other side, and that's on the economic and the talent and the business and the entrepreneurship. So yes, exactly, you're right on, and that's the whole point of the comments, yes.
Okay, any other panelists want to address that issue?
I'd just like to chime in that at least as far as the criminal justice sector and detention facilities, our problem isn't a technical one. Ours is a political one. It's deliberately the politics of exclusion. It's caging the population. It's keeping them out of the political process. And most importantly, as it affects, I think, this discussion in the FCC, it's about depriving them of choice and allowing them to choose which carrier they're going to use to carry their phone calls and what rates they're going to pay. And as long as the people paying the bills aren't viewed as the consumer, the technology isn't really an issue.
I think for Indian country, it's a matter of being invited to dinner, but not being allowed to eat. So I don't think it's a matter of innovation and creativity. I was at Arizona State University about a month ago and talking about broadband inclusion and media. Native Public Media is about access, control, and ownership of broadcast facilities. We have 58 radio stations and 4 television stations across Indian country. And we need broadband to proliferate our communications network even stronger. And in talking to these youth, I was talking about telecom and what it could do for Indian country, the promise of bringing this technology and addressing our economy, our education, our health, our public safety. And one student walked up to me and she said, when I was talking about the solar, really basic technology, she said, I've been thinking of ways to bring solar sails to Indian country. So definitely the creativity and innovation is there. In 2010, Native Public Media published a report on internet use across Indian country, and we found that if given the opportunity, if given access to broadband, Native Americans will use the technology.
Okay, just want to remind the audience that if you have a question, feel free to go to the mics or to write a question on some cards that are available to you, and we will read those questions for you. Yes.
Hi, I'm Cheryl Lance. I'm with the United Church of Christ, OC Inc., Media Justice Advocates. My question was really for Paul, and I know he had a short time to articulate at the beginning of the session sort of the overall picture with prison phone, but I think it'd be really illuminating in this instance because the FCC and the Commissioner have done so much to try to address the problem of predatory prison phone rates, and yet the intractability of the industry opposition has been so strong that every step forward seems to entail a couple other, other difficulties. And I wonder if you could just elaborate a little bit more on maybe one example of how the FCC tried to put a stop to a really egregious practice, but then what the industry response, instead of the industry saying, okay, now we understand, we get the message, and then the industry makes another response, and sort of just tease that out for folks to sort of see how the dynamic works in a more detailed way.
Well, I don't think it's a very complex dynamic. They're in business to make money, and they've realized that exploiting a disadvantaged population that doesn't have a lot of economic choice or technical choice is really the best way to do it. So they have really done a lot of that, and when the Commission has tried to cap their rates, they've challenged the rates in court. Our organization, we're intervening in that case to try to defend the FCC's actions as well. But it's just been a long running effort. They started this business model. They're very determined to keep it in place. Their livelihoods depend on it as it currently exists. And one of the other things they've done is they've started branching out into other areas. That's why I say the problem isn't a technical one. For example, seeing the prison phone industry part of their business plan being regulated by the FCC, even fairly nominal regulation, one of the things they're doing is expanding into video visitation, and one of the things there is they pressure institutions that they sign these monopoly contracts with to end in-person visitation, which is a formally free government service that's being provided, and then they want to charge prisoners and their families up to $1 a minute to use substandard audio and video quality video visitation in lieu of in-person visitation. And so these are the things where just as they're being squeezed on one end, they just move into another one, faced with limits by the FCC on how much they can charge for people to pay their phone bill. They then lowered the amount of money that family members can use to pay their phone bill. So basically it keeps their bottom line at about the same while continuing the exploitive process. So each regulatory step has been met for the most part with their accountants and lawyers going back to figure out a way to sidestep the measures that have been put in place.
Okay, we'll yield the floor to the Commissioner.
Yes, I know you're going to get sick of me, but that's just too bad. Just wanted to ask each of you, if you were a regulator, if you were in my shoes, federal or state level, if you were a lawmaker, if you were a policy, maker from a different plane, what would be the 1, 2, or 3 things that you would institute that would make a world of difference in your respective portfolios?
Man, Commissioner, you read my mind. Who wants to go first? Or you want me to choose who goes first? Go ahead.
Well, I think one thing, so I mentioned a very specialized population that we care a lot about. It's not a large population, but that's true of many of the populations we're talking about. And I think, to be fair on the vendor side, it's not always clear who these populations are, what their needs are. So I think what regulators could do would perhaps be to sort of make visible some of the populations we want to serve when we're thinking of new products and services, and to be able to broker a discussion about what's the design center, what do we need to do to serve different populations as we keep advancing new technologies.
Paul?
I'd say mine would be a quick succession of things. I think it depends, starting from better to worse, or from most important to least important. I think one of the things is allowing consumers to choose the carrier that is going to carry their calls to and from detention facilities. That takes out the monopoly contract aspect. At that point, the companies would also have no one to pay a kickback to. They would actually have to compete in the marketplace with consumers to decide who can provide the best service at the lowest cost, just like everyone else in the telecom marketplace has to do. And so I think that type of level playing field would eliminate a lot of the problems. One of the other issues is a lack of transparency with the current thing. What exactly are they doing to get these contracts? How much are they paying in kickbacks to get them? And what are the terms? What are the rates? What's the actual cost of these contracts? And what are their profit margins? This lack of transparency is something that's really hampered, I think, any effective regulatory action and legislative action around these steps. So I think those would be the two most important things that could be done.
As mentioned earlier, much of the dialogue has been about the access from the consumer, and I certainly recognize and empathize with each of the positions that you're in. But I think we actually have to begin to focus and have the dialogue begin on the economic empowerment component. So when I think is, having been a former regulator, what can government do to help lead that? And when you think about, in the energy industry, everyone's trying to gather and get cohorts together so that we're talking about the value of industries. Mobile technology is the same thing. We need to be talking about it and reaching out in our communities so that people know and what it is, so that they see the likes of Commissioner Clyburn out there and know that, being involved in these industries is a key possibility. And we must continue to keep that dialogue going and to have that happen. So that's where it has to start. Recognizing, yes, there is a disparity. It's out there. And we just need to figure out how to address it appropriately by creating pipelines that are positive to get our students in the appropriate career opportunities and to make sure our entrepreneurs have the tools they need to succeed in the mobile technology world.
Okay. Loris?
Wow, it's like being asked to pick one Christmas present. I can have three. Okay, I'll take two. I'll be conservative here. So I would say that tribal consultation comes to mind, and tribal consultation that confers substantial rights within the process, and which is also procedural, I think is important. I think parties have to come to a mutual decision of what that would entail. Now, there's been talk across Indian country of perhaps legislating tribal consultation across all federal agencies, and I don't know if that's the route to go, but I think the FCC could take the lead in showing and demonstrating to other federal agencies what that tribal consultation could look like. Tethered to that, tribes need technical assistance. The idea for a federal FCC Office of Native Affairs and Policy was to staff that office with economists and engineers and other lawyers and other professionals that could help move tribes along so that we can close the digital divide across Indian country. So I would just say technical assistance and tethered to tribal consultation.
Okay. I have one final question, unless there's no questions from the audience, okay, at this point. So for both Monica and Loris, how did the Lifeline reform affect the communities that you're both advocating for specifically, and what could have been done differently to create a better environment for those you are advocating for today?
I mean, certainly as mentioned before, with Lifeline reform, I mean, it is, everything is about access at times. And so as we look at that, I think we have to look and see what that point of entry is. I mean, we do that and work in many different sectors for many different items, whether it's low-income energy assistance like LIHEAP or something else. I mean, that we need to make sure that that access can happen and that it's seamless so people can get that access, and that'll help get people to where they need to be so that they can hold the device in their hand and be smart about it and being able to use it.
Okay, Loris?
Talking about opening Pandora's box. So Lifeline in Indian country, in terms of recent developments, has not been a positive experience for tribes. And I guess what I can say is that the trust responsibility of the federal government applies to all Native nations, whether you're talking about the Zuni or the Navajo or Hopi or the Sioux or the Lakotas. And I think the lesson out of our dealings with Lifeline is that there has to be a forthright and transparent working relationship with tribes. There has to be a light of clear expectation. We just cannot have situations where the FCC decides to meddle with the boundaries of tribal lands to implement a program. And I think that's a lesson for all of us, and that's really what tribal consultation can take care of, and it's really the route that tribal governments are advocating for, is that they would like to be consulted before a project takes place, before the pipelines are laid down, not after. And I think that's the lesson. Lifeline program is extremely important to Indian country. As I mentioned before, it's the one program that has made significant impact across our tribal communities. It's important to keep that program. It's important to keep the eligibility of individuals that have been on that program. Without really going into all the details, it's been a rough road, at least for those of us that work with Indian country, to work with tribal leadership to bring them back to the table and to have a process that works for all of us. Thank you.
Thank you. So right now, I'll give each one of you 30 seconds to do your wrap up. And so we'll start with Loris, going down to Dave.
Digital inclusion means simply that, inclusion. And it means that we have to take a hard look at the policies that govern deployment out to Indian country, the policies that govern access, those things that include affordability, including training, digital literacy. Across Indian country, it's been the same story year after year. But what's been really important to Indian country is that when we develop a really strong working relationship with the Federal Communications Commission, there are solutions that can be found. And the solutions are simply, can be framed in terms of a working relationship with tribes. And I want to thank Commissioner Clyburn for taking the initiative to come out to Indian country to learn firsthand about the situation in Indian country and to work with tribes to try to find real solutions.
Thank you. 30 seconds.
Mobile innovation contributes $540 billion to our economy. In the U.S., that's 3.2% of our GDP. Looking at 2020, it'll be 5% of the GDP. We must make sure that that talent pipeline and the entrepreneur pipeline is there. We need to make sure that we have familiarity, knowledge, and training of the industry out there for all. You can be what you see, but it's hard to dream to be what you don't know. So we need to get out there and educate and get the word out about the opportunities.
Thank you.
Paul?
I say that access to digital technology and also access to your loved ones also includes affordability. And one of the things we've long advocated for is the cost of prison phone call should be no more than 5 cents a minute. On video visitation, there's no technical reason it can't be free, as it is in countries as diverse as the Philippines and the Netherlands. There's no technical reason it can't be that, and it can't be free. And we don't believe that just because it's called technological innovation it shouldn't be a guise for just plain old exploitation of poor and disadvantaged people in the 21st century. And we can do better than this.
Dave?
Yeah, I think our goal is to make the world more accessible, and I think it starts by I think people want to do the right thing, vendors, but it takes by making more visible the needs of a lot of populations, and I think creating that awareness is part of our job.
All right, thank you. I want to thank our panelists for doing a fantastic job. I think our takeaways are pretty simple. Tribal consultation is one that is important. A pipeline and economic empowerment for inmates and their families, justice. I think that is probably a fair way to say that. And then finally, for the deaf and blind, ensuring that we have equipment that actually makes sense for those who are using it, and that we can bring all the parties to the table to make that happen. I want to thank Commissioner Clyburn for putting this together, and her team, particularly David and the rest of the team, for putting us together. Now we are entering into a break. It's a 20-minute break, so please enjoy the break. Come back refreshed for the keynote.